in listen-only mode.
Good morning, everyone, and welcome to this happy day. Tony, do you want to start us off with our advocacy webinar?
Yeah, good morning, everybody. September 9th. Hopefully all is going well. The cool weather is coming. The Buckeyes have lost, so that is probably still fresh on everyone's mind, and I'm sure everyone's depressed over that. Wanted to start out by going to, oops, I think I just clicked out. Wanted to start out by giving a quick Statehouse update. These are some of the bills that are going to be in session. Some of the things that are really being talked about right now, the legislators are on recess, so they're back in their districts again. You know, like I've said the last couple times, a great time to go talk to your legislator, get them involved in maybe a meeting or something that you have with your coalition. Also a wonderful time to have them come out, talk about their priorities and things if they get reelected. And don't forget about also new candidates as well, especially if they're term limited out. That would be a great time to understand what the new candidates, what their priorities are, and what they also what they want to talk about, what they want to do in their term. Some of the things that are really bubbling to the surface, just on a wider scale. A lot of repeal over Common Core, which is an education piece that some people are upset about. So there seems to be a divide in the Statehouse. I don't know that much about Common Core. I know that the Democrats hate it, and Republicans, some Republicans hate it, some love it. So I just don't know that much about Common Core, but it is it's an education standards that are happening in Ohio, and they want to repeal that for some reason. There's also a lot of talk about judicial and legislative salary increases, which they're saying that Supreme Court justices are not getting are not paid enough, and they're losing candidates because they don't pay them enough. So there's talk about giving an increase. I guess they haven't had a salary increase since 2008. And then they want to try to get to I guess a better pay scale for them. There's also a lot of talk about increase in funding, increase in collaboration with local law enforcement. There's been some complaints that state agencies don't communicate well enough with sheriff's offices, with chiefs of police and local law enforcement for drug-related issues. That received some attention in the last few weeks. So they're going to try to do something, perhaps introduce a bill to ask for better collaboration, also increased funding for these local law enforcement agencies. And then also the House Bill 501, which is they want to rewrite the Zohydro bill. Zohydro, they were going to outlaw in the state of Ohio, make it illegal. However, that's not legal to make a federal, an FDA-approved drug illegal in a state. So they have to go back and just create tighter restrictions on what on who can prescribe Zohydro, who can, or what kind of dosages and those types of things. So hydro is basically, from what I understand, I've heard everywhere from 3 to 10 times more powerful than OxyContin. So it's a pretty powerful drug, very addictive. A lot of surprise, and a lot of surprise that it was even approved by the FDA with all of the issues that that OxyContin and prescription drug has had. over the last few months. Some Ohio bills that basically we're going to be in a lame duck session. Someone asks me, I keep saying that, what is a lame duck session? A lame duck session is basically when legislators either are up for election or they're term limited out. It's a period of time that legislation goes through really, really quickly because they have to finish by December 31st. And actually earlier than that because they all take Christmas breaks and Thanksgiving breaks and all of that. So it's a really, really quick time. They try to rush a lot of bills through before they are either ousted because of their election or they run out of time because of term limits. Now, what happens is that every bill, there's been like 600 bills, 600 and some odd bills introduced in the House and 300 or 400 in the Senate. Now, what happens is once the new General Assembly, January 1st, a new General Assembly is introduced, which means all of the bills that have taken place, the 500 or 600 for the House and 300 to 400 for the Senate, they all disappear. If they haven't passed. So the bill just dies. So some of the bills that that I thought were kind of interesting that will probably die is one of them is House Bill. It's the drug overdose piece. Basically, what happens? It's House Bill 508, which is it's drug overdoses, and it was introduced by Representative Butler. And what it does is basically increase the penalty for selling someone an opiate. Right now, it is involuntary manslaughter, from what I understand. If you sell someone an opiate and they overdose on it, if that person dies illegally, this is not for physicians, but it's illegal. And right now, it's involuntary manslaughter. The bill actually was created to make this a life with parole, imprisonment for life. If you sell someone an opiate illegally, or you give it to someone and the person overdoses and dies, there would be it would be expanded to life with parole after with parole eligibility after 20 or 25 years. That will probably die. It got one hearing, and we aren't hearing any more in the House about that. House Bill 529 is another one that it increases the penalties for giving pregnant women a controlled substance. That was Margie Condit was the sponsor on that one. House Bill 598 actually might have a chance. They have talked about entertainment districts forever, and this is where they want to create districts where there'd be exemptions from the open container law. So people would be able, within these entertainment districts, which is a half-mile by half-mile area, they wouldn't have to worry about open container laws. It would repeal those. House Bill 612 actually has not had a hearing. It will probably die as well, which basically would give more of the local counties, municipal corporations, townships, drug program funding, usually for treatment. So that will probably die. Also, House Bill 609, suicide awareness, that might pass, but I doubt it. Basically, it would be suicide prevention awareness or suicide prevention, I guess, programming on college campuses. So these are just some of the bills that will probably end up dying, especially with so much on the Common Core and the judicial sessions. Wanted to go to the next slide. There's a federal bill that we were contacted about. Sherrod Brown's office, Senator Sherrod Brown at the federal level. He was a co-sponsor on Senate Bill 2645 called the Recovery Enhancement for Addiction Treatment Act. And what it would do was expand medication-assisted treatment to include practitioners. So it wouldn't be just a physician that would be able to give this to opiate addicts and those types of people who have those types of issues. But it would also include nurse practitioners, physician assistants. It would have to be done in office. You couldn't do it out on the street or in a home or anything like that. It would have to take place actually in a treatment center, in a physician's office, and have listed some of the senators that have signed on. Richard Durbin is a big name. Sherrod Brown, of course, we know. Dianne Feinstein is highly ranked in the Senate, and then Rockefeller. I think we all know some of the Rockefellers of old. Some of the questions that I didn't think were addressed that were some of the issues that I saw with the bill were, in addition to just the medication-assisted treatment, would there be counseling requirements? I didn't see anything on that. So it would be basically medication-assisted treatment, but it didn't have to be followed up with, yes, you have to seek some kind of counseling or therapy to help you through your addiction. Also, I didn't see anything about additional training for these folks. I'm sure there would have to be the nurse practitioners or physician's assistants or any kind of funding tied to it. What we do have, I think, at our next SPECA meeting is Chad Smith from Senator Sherrod Brown's office will actually be at the next SPECA meeting. So this would, this will be some of the, I'm sure, a topic of conversation that he will probably address. So come with your questions about this. Maybe makes us look good too that we might actually know a little bit of something. But again, these are some of the things that have been introduced. In fact, Sherrod Brown actually had a press conference about this a week and a half ago. But again, next SPECA meeting, which is a week from today, the 16th, at the Worthington Northwest Library from 10 a.m. Be sure to make it to that, as Chad Smith from Senator Sherrod Brown's office will be there to talk some federal legislation, I'm sure opiates, and any other issues that might be of concern to you. Powdered alcohol, House Bill 594. That's another bill that we hope will get through in the next session. It will again move very quickly. There's some other partners that are kind of taking a lead. However, I think it is very, very important that we take the public health approach to this. We really don't want powdered alcohol to be legal here in Ohio. We've talked many, many times about the issues with powdered alcohol, whether, it looks like basically a Capri Sun packet that you pour in a bottle of water and it creates an alcoholic drink. It's easily concealed. We think, with the underage drinking, it would really, really be enticing to kids to be able to hide this and be able to take it. Also snorting it, even though the owner of Palcohol, the creator of the Palcohol, which is the powdered alcohol brand name, says that it hurts too much to snort. That sometimes doesn't ring true with some kids, especially kids who light themselves on fire and things like that on YouTube, which I've seen in the last few weeks. Senator Chuck Schumer said that he was going to introduce federal legislation. He said that on August the 11th, and we have not seen a bill come out yet. So we're still working ahead into getting this deemed illegal in Ohio and not waiting for the federal legislation, because I don't know if or when that will happen. We do have a work group established. If you would like to be part of that work group, we will have a call in a week or two. I'm sure we'll talk about it at the next SPECA meeting. If you want to be a part of that work group, please give myself or Allison Scherer in our office a call, and we would be able to help you out there. The next, there is a marijuana update. At the state level, they're still trying to collect signatures. Momentum has somewhat not died, but slowed quite a bit since they didn't get their signatures. There's a lot of infighting now within the Ohio Rights Group, and they're still trying to collect signatures. They're obviously not going to be on for this year. They only collected 100,000. I doubt they'd be on for next. They would be on the ballot for next year. There's some big money coming in, we've heard, in 2015 or 2016, so it might be a whole different piece of legislation or ballot initiative. However, there was an introduction of an ordinance to the Toledo City Council by the National Organization to Reform Marijuana Laws, the Northwest Ohio chapter of that organization. And what they wanted to do was they basically wanted to decriminalize marijuana in the city. Well, we've already got decriminalized marijuana in Ohio, so what does that mean? Why would we want to, well, we don't, but why would they want to decriminalize marijuana in Toledo when it's already decriminalized in Ohio? And what does decriminalize mean is basically you can have 3.5 ounces or 100 grams of marijuana, and the most you can get is a $150 fine. An ounce of marijuana is about 54 joints, according to 420 magazine. So you can have, approximately 150 joints, and all you can get is a, basically a $150 fine. In Toledo, the ordinance would have read, and again, the Toledo City Council did not pass it. In fact, only one person voted to allow this, and there were like 6 or 7 that said, no, this is not good for the city. But basically what this would have done was a person would be able to gift marijuana to others within the city limits. So what that means is you'd be able to give it away. No limit on whether the person's a citizen of the city, whether maybe you just come to Detroit, come from Detroit, come from Cleveland, and you gift it to each other. At one of those fun parties, I'm sure. Some of the problems with the language was there was not an age limit. So would it be legal? And I guess the language didn't specify, but would it be legal to gift marijuana to a child? So if you're a parent and you, for their 16th birthday, decide to give, a couple grams to your kid, that would be, I guess, perfectly legal according to the language that would have taken place in the Glass City. Also, a person could not sell marijuana, so again, it goes back to gifting it to each other, giving it away. However, if they are caught selling it, this is what the language said that I thought was really, really interesting. The person shall not be fined, and there will be no incarceration, probation, nor any other punitive or rehabilitative measure be imposed. Basically, so it says that you can't sell it, but if you get caught selling it, there's not even a fine. You can't even get a fine for it. So I don't know if they could confiscate the marijuana, but they couldn't do anything to the person. So if you have 100 pounds in your, in your trunk, which is a ton, not a literal ton, but it's a lot of marijuana. Then it would be basically, there could be no punitive measures brought against you. The other piece of legislation, or piece of the document, the ordinance, that I thought was interesting was a person cannot have more than 200 grams of marijuana in their possession, which is, again, 7 ounces or approximately 378 joints. However, if the person has over 200 ounces, or I'm sorry, 200 grams, the person shall not be fined, and there will be no incarceration, probation, or any other punitive or rehabilitative measure shall be imposed. So basically, yes, you can't have over 200, but if you do, we can't do anything to you anyway. So this was basically legalization in its purest form, that you couldn't do anything to the person. You can gift it. You can't sell it, but if you do sell it, no big deal. They can't do anything. And if you have, no matter the amount, they can't do anything to you anyway. So this is something that, again, the Toledo City Council did not pass. They said that they're going to come back in the next year and try to get this done through ballot initiative. So this is something that really, really concerns us, and for our friends up in Northwest Ohio, this is something that really, really should be concerning to the state. Colorado, they recently passed an edibles bill because there have been some people who have died. They've had some hallucinogenic pieces that have happened. One young college kid jumped off had a pot brownie that was he's supposed to eat a sixth of it, and he ate the whole thing, and he ended up having a hallucinogenic episode and committing suicide, jumping out a window. Another was a husband that shot his wife after eating one of these marijuana edibles. They introduced new labeling laws and what is legal in the state because they're having so much trouble with this. Also, emergency room admissions, kids that are getting into their parents' pot, pets are getting into their parents' pot, or their owner's pot. So, this is a really, really big issue. And I brought this slide up just as an example. This is Claude. Claude is a black cherry gummy bear that has THC in it. And basically there's 100 milligrams of THC per bear, which is just that will send you on a trip, man. And basically the new law says that you can only have 100 milligrams of THC in a package now. Used to be you could have 10 bears per bag. However, now you can only have 1 bear per bag. But the recommended serving of a bear is 10 milligrams. So you have to split the gummy bear, and they put it next to a dime, so you can see it might be a little bit bigger, but it's not a great big gummy bear. This is not a uber gummy bear. This is a somewhat regular size. That basically you have to split that little gummy bear up into 10 different portions for it to be a serving. I don't know about you, but this guy, when he gets a gummy bear, he just sticks the whole thing in his mouth. He doesn't worry about, oh, I can only have an ear or I can only have a foot of a bear. And this is really, really quite dangerous to folks. This will jack you up, especially if you're an inexperienced marijuana user. And this would do some damage to you. As far as hallucinations, as far as creating psychotic episodes, and these are what these, especially these edibles, are tied to at this point. So this, basically, you can only have 100 milligrams in a package. There were no limits before, so you could have had, like in this case, there were 10 bears. You had 1,000 milligrams in that package. So they're trying to get hold of this, but again, these are things that are really, really dangerous and to me have much more of an impact than just the smoking marijuana, where you see about the average out in Colorado is about 13% THC in smoked marijuana, and in these edibles, you can have up to 70% THC in some of these things. So it really is just a really, really big issue, and wanted to let everyone know that what is going on out in California. And really, these things are actually, they found a bunch of gummy bears down in southwest Ohio. John Berkey actually sent me pictures of a bus. It was all Colorado edibles. So these are actually in Ohio. You might want to start doing some awareness, education about these to parents and things about these edibles, and I can send you, I've got pictures galore of these things and a lot of information. So if you need more information on that, let me know. I can send you that, and we can, you can start educating your community. Because again, even though it's illegal, it's been found in Ohio already. September 16th, the rally, which is also a week from today, there's Ohio's Rally for Recovery down at the Statehouse. You can join the many voices that will be down there taking pride in their recovery. So that will take place on the 16th. And finally, we also wanted to make one more announcement. The 23rd, which is 2 weeks from today, is the Coalition for a Drug-Free Greater Cincinnati is having their Coalition Academy at the Great Wolf Lodge in Mason, Ohio. Kevin Sabet will be the keynote there. It will be a great day of learning and not only refining skills that you already have, but learning about new evidence-based practices, especially around coalition work. So we encourage everyone to sign up for that. That's and you can do that at the phone number that was on the screen, or through the email info at I think what is it, Drug-Free Cincinnati. Just go to those. There it is, info at drugfreecincinnati.org. You can sign up for that. Are there any questions or anything?
We do have 2 questions. The first question is from Nancy, and she wanted to know if you could mention anything about the DEA's new policy related to the prescription drop-offs at pharmacies or hospitals.
Yes. The DEA just opened up, they worked with the FDA to open up where you can put drop boxes. Used to be, it was that you could just have them in police stations. However, it has been opened up to pharmacies. So, and that includes like Giant Eagle pharmacies, Kroger pharmacies. So it's even grocery store pharmacies. Also, you can do it at nursing homes, those types of places. So it really does open up where a group or where a community could put a drop box. It's a lot more. I know that I don't ever go down to my police station. However, if I have it, right there as I'm going into my Kroger pharmacy or CVS or whatever to pick up my meds, I can drop those off. So I think it really will be another great tool to add to keeping these drugs off of the street. So please, this is just brand new. I think it was just done this week. It was just finalized. So this is a great opportunity to start having some conversations with local pharmacies and those types of establishments to get those drug drop boxes in there. And you said there was one more.
Actually, there's 2 more. I think.
Okay.
Mary wrote in that you could also register for the Coalition Academy at drugfreecincinnati.org, so I added that web address to your screen, so you should be seeing that. And then the only other question that we have now is from Steve Carell, and one more just came in. From Steve, who wants to know if you would be able to send that information about the edibles along.
Yep, absolutely. I will do that.
And then from Angela, she said, we received a letter from State Representative Sean O'Brien saying that they have declared September of 2014 to be Amend Ohio Social Host Law and Help Protect Ohio's Children Month, 2014. In addition, he states that they will be examining House Bill 351 for the 128th General Assembly for reintroduction.
Wow, that's good news. So that should excite everyone about the social host laws. I will follow up with Angela and see if we can get that letter and send it out to everybody. Let's have a concerted effort on this to see if we can, if there's going to be a reintroduction, let's get this thing passed this time. So that is great news. Thank you so much, Angie.
And then Angela just wanted to mention that House Bill 351 is to amend Ohio social host law. So we'll be following that, and then Tony will be connecting with Angela. If you have any other questions, feel free to enter your question at the question section of your GoToWebinar navigation pane. Our next advocacy webinar will be October 14th at 10 a.m., so we'll send out a reminder for that within the coming week, so you can schedule for that. And you can always visit drugfreeactionalliance.org /calendar of events to see what additional things we have coming up. So that is all the questions that we have for now. If you have any things that pop up between now and our next call, feel free to contact Tony at tcoder@drugfreeactionalliance.org or call us at 614-540-9985. Thank you so much, and enjoy the back-to-school days and the beautiful weather that we're having. Talk to you next month. Bye-bye.